Well, good morning, good afternoon, good night, whichever time you choose to watch this podcast. I think we all know by now I'm Dr. Cheryl C. Burks, the Citizen Engagement Specialist for Spalding County. And today I have a special treat for you, not so much because he's awesome in his profession, but because I think what he's going to bring to the table, this conversation, is something that can really, really help us in our community. I know many of you may be aware, and if you're not, I'm informing you right now. For the past couple of months here in Spalding County, we have had a number of things to happen that's devastation or travesty and just really kind of barreling down on our community as something that's going on that we need to become aware of or remain aware of or become astute to pay attention to. And that things dealing with our mental health, the mental health of the different citizens, the residents of Spalding County. Because I think in July and in August, we've had a number of suicide attempts. We've had young people to be involved in tragic accidents. We've had a young life to be lost based on gun, not being careful with the guns. But it also made me realize that we have so many things going on, even in our nation, even in our state, that kind of can be overwhelming for us. So I have with me today Mr. John Tavius Jones, which is a therapist, correct?
Yes, ma'am.
All right. And his program is called Seed Community Enrichment. Is
Yes, ma'am.
that correct?
Yes, ma'am.
And you're located here in Griffin, Spalding County,
Yes, ma'am. I have an office by the football field.
by the football field. Okay, and the reason I wanted to bring Dontavius on is because number one, he's a member of the chamber. Am I correct?
Yes, ma'am.
Okay, and he's a proud member of Spalding County, and he has his own business. He's an entrepreneur. So, in his profession and the different things that you do around the community, you get to see some things as well.
Yes, ma'am.
But I know we're not going to get into specifics of your patients or anything like that. But what I wanted to do is to offer information to the public about what is it that we're looking at, what we need to remain aware about, and what we need to be vigilant about. Is that kind of making sense of where I want to lead this conversation?
Yes, ma'am.
So, having said that, my first question I'm going to ask you is for folks hearing your name for the first time, who is John Tavius Jones and what drew you to this work? I told him a snippet, but you can elaborate on
Yeah. So,
John Tavius.
as Dr. Burt stated, my name is Jontavius Jones. I'm a licensed clinical social worker. I was born and raised in Griffin. I feel like a lot of the problems we're seeing today, I received the support so I didn't have to go through the things that our young people are experiencing. So I wanted to bring that back to Griffin, to Spalding, to support the youth and the adults who feel isolated and who don't feel like they have a place to belong.
Okay. So, your own personal experience you said something that I think caught my eye. You got the help that you needed at a young age, and you saw the value of it, and therefore you wanted to bring that back to our community.
Yes, ma'am.
Okay. All right. So that tells us in a nutshell that there's a commitment there, a pride, for, hey, I understand what I got and I understand how it helped me. How can I give that back to my community?
Mm-hmm.
So let me ask you this, in what you've seen just in the atmosphere or in your dealings around the county, are young people suffering way more than maybe we did? Not you, because you're young. I'm like on that other side. I was like born in the '60s, so I'm on that other side. So, are you seeing that the young people of today, the millennials or the Gen Z, that they're kind of struggling a little bit more, or maybe they're more aware of their feelings, maybe that we probably weren't?
Yeah, I'd say they and I struggle differently than the previous generations have. We're more connected now with social media, but with that, we also compare ourselves to other people a lot. We see the good things on social media, and our lives don't always look like that. And that can make us feel depressed, make us feel anxious, worry about the future. What if I'm not that successful? So I
Mhm.
think a lot of that is playing into what we're seeing today, in my opinion.
Okay, and one of the things that I'm hearing you say, and I'm gonna tell you that's this old brain hearing what you say, is that they don't see themselves as they're comparing themselves by things they see on social media that's not necessarily the real life, the real world.
Hmm.
Okay, because sometimes people don't put out there that this morning I woke up and I didn't feel well. I just waited till I got my makeup on. I waited till I put the filters in, and then I put out there, "Hey world, this is who I am." So that because of social media, if I'm hearing you correctly, those are some of the things that millennials and Gen Z struggle with that we may not be aware of. Is that something that will happen with the younger generation? The number of likes, the number of looks. So as a community, and I know this ain't not on my piece of paper, so I'm gonna ask. So as a community, what can we do about that? What? Yeah.
I feel even though we have social media and it's a form of connection, I feel we don't connect on a deeper level. We think we know people, but people don't really know us. We don't give ourselves a chance to be vulnerable, and we don't know how to kind of sort through our own emotions,
Uh huh.
and we kind of just sit with it in isolation at home, feeling
Okay.
connected to people from a distance sometimes.
So, and we're going to go down this rabbit trail because I've seen it on television. But so, do you think it may be a good thing that in the public schools today they're taking the phones so that they can have them if they have access to them if there's an emergency, but it kind of is forcing them to socialize with each other or be in the moment.
Yeah, I can see that as a good thing. When I was in school, I know we didn't I didn't have a phone until I was like in the 11th grade, and I still have the same phone number. But I wasn't distracted by my phone because I knew I couldn't be on it, and the
Mm.
internet isn't
Mhm.
what it is today.
Oh wow.
So I didn't have as many distractions.
Okay, so it really, the information highway, the internet, as people call it, we're bombarded with so many things that it may be one simple thing going on, but it can bombard us in different ways based on the different senses that we have, and really how we are connected on the inside. Okay, I went down that rabbit trail. I'm sorry, I just went there, and so I wanted to stay there a minute. But one of the things that I know has happened in our community in the past couple of months, we've had a number of suicide attempts and suicide success. So, when we say suicide prevention, what does that really mean in everyday life and not in a clinic? What does that mean? How can we, as citizens, help in that? Well, I took it down the road. When you say suicide prevention, what does that really mean in everyday life?
I think it means being able to talk about suicide and suicidal ideation without having that stigma to it. I
Okay.
think with that stigma, people don't want to talk about it. If I share this thing, I'm going to be committed. People are going to think I'm different. So there's fear there. And that fear grows when it's in isolation. So I think being able to have these conversations, and I'm a clinician, I'm trained to deal with these things. So I go a little bit deeper on the personal level. Every day you don't have to go that deep, but listening to people, kind of seeing what they're going through and giving them that support, I think that is a good way to prevent suicide. And if you're worried, ask. Don't be too afraid that you asking about that would cause that person to follow through on something or have thoughts they weren't having before, because that's not true.
Okay, so let's put a pin in that. So over the years, and I do remember having that conversation when someone said, "Ooh, don't say anything because they may make them do it." So you're saying that's really just not true.
Mm-hmm.
And what you're recommending that we do have this conversation
Mm-hmm.
and even ask the question, are you thinking about hurting yourself?
And
And
that gets tricky too with hurting
okay.
yourself. Maybe I'm not thinking of hurting myself, I'm thinking of killing myself. So that person,
Oh, so hurting and killing. See that? Okay. So we're learning something right here. So have the conversation. And it may be difficult, it may be challenging, but it might be that one thing that kind of keeps them talking. And then I'm making and becoming aware that this person cares enough about me to ask me what's going on, and we can have a conversation about it. I I promise you, I didn't stage this, but I was just at a place a couple of weeks ago, and this lady had packed up her car. This was her telling it. She packed up her car, was going to get one last meal, and then she was just going to go and kill herself. However, when she went through the food line to get the meal, a person noticed something about her, and so she talked to her. She just talked to her and talked to her until she finally felt okay enough to open up. And when she opened up, they stayed close with her. And then here she is 3 weeks later saying, if it had not been for you all in that line, I would have taken my own life. So that's really just confirming what you said, taking the time to ask the questions. So in our community, we do not need to be afraid to have the difficult conversation. And we need to be able to understand that, the answers that they give us, it might be a little shocking, but we still stay engaged. Okay.
And if you are worried, that's when you connect people to resources. It's not necessarily your job to talk them off the ledge. You can connect people with the resources they need
Okay. All right.
when
So,
you feel
having
overwhelmed.
said that, with the resources and things, I know here in Spalding County, there's the Spalding County Resource Directory. It's a web-based directory that has so many different resources. It deals with food, it deals with clothing, but it also deals with those things dealing with the mental health. And that's what we want to get people to, the space of having positive, healthy mental health. Because somebody asked me a question one time, when our arm breaks, we go to the doctor and they cast it up. But what happens when the brain breaks? That's kind of like this, we go to those resources. We go to, okay, so we're having this conversation. Okay, what are the most common warning signs family, friends, teachers, and coworkers can spot early?
I think when you see the person kind of pulling away, if they make a complete change in who they are as a person, if they're normally extroverted and they become very quiet, that may
Mm.
be a warning sign.
Oh,
And
okay.
sometimes things like abuse, trauma, they can cause a shift in behavior. And just kind of acknowledging it, asking a question, and if you think something's going on, say something.
Okay. So, what immediate steps should I take if someone says, yes, I'm not safe at home, at work, at church, or at school? What steps should I take?
So I think that's where you connect them with the appropriate resources. Sometimes parents can be abusive. You, your job would be to let a mandated reporter know, or you can make a report to DFACS yourself.
Okay. Do
And
I have to leave my name if I
you
make a
can,
report?
if you make a report, it can be anonymous. And
Okay,
the
okay,
people you
okay.
report, like if you report on someone's parents, their parents aren't notified of, hey, this person said this about you.
Hmm.
You're just giving the social worker the information, and they follow up, they do the investigation, and they'll contact you as well to get more information. And if you want to be anonymous, they'll leave your name out of it.
Okay,
But it's not your job to gather that information for them. If someone says, hey, my parents are abusing me, you connect them to a teacher, you call DFACS yourself, you let them handle it.
okay.
And you can follow up and support that person as they navigate that process if you want to.
Okay, so I'm hearing you say that if I call in and say, hey, uh, at such and such address, I see that this is happening, or you could give the name, but I don't want to leave my name. I just want to make sure that this information is reported. And that way, we don't have to feel like we, no, my mind went to snitches get stitches. Don't go with me on that.
Okay.
No, that's where my mind went. But at this time, you need to snitch. If something is going on, if you see something, say something. That's normally what I tell my children. So again, you can call anonymously. And again, you said something real, I think poignant. It's not our job to gather the information. It's to report it.
Mhm.
So that's their job. They're the experts. So they know what to ask, they know what to do, and they know about the help that's available to them. Okay. Um, how can primary care how can primary care school employers and faith community spot issues sooner and connect people with care faster?
I feel forming a deeper connection
Mm-hmm.
with the students, I think that'll help prevent these things from happening. Well, may not prevent it, but we'll catch it sooner. It's like
Mm-hmm.
Timmy and I have a good relationship. Timmy,
Okay.
if something is happening with Timmy, I'm sure he'll come to me and talk
Okay.
about it. Or if I ask, like, hey, Timmy, I see a bruise on your arm. What's
Okay.
happening? So I
Okay.
think forming the relationship so we can pick up on the signs sooner and so that people feel comfortable telling us what's going on with them.
Okay. So if I report it and they find something is going on, will they contact me again, or they just take it and go on with it?
It depends on the process. I think me as a mandated reporter, if I make a report, I'll receive updates on that. I'm not sure about
The average Joe Blow.
Yes, ma'am.
They're just reporting.
Mhm.
Okay. How do culture how do the culture of faith and family norms shape how people ask for help or don't ask for help?
Yeah, I think that shapes how we cope. If I'm religious, I have faith in God, I may pray when I'm struggling, and
Mm-hmm.
that helps me cope with my issues. If you come from a family that doesn't talk about their issues, that doesn't talk about emotions, you may have a harder time coping with them. You
Mm-hmm.
may not like emotions. Emotions are this big, difficult thing. So I
Yeah.
think our background shape how we see it. It shapes our perspective. But at the end of the day, having emotions is nothing to be ashamed of. Having suicidal ideation is nothing to be ashamed of, because we do have intrusive thoughts. Not every thought we think is our thought. Sometimes it's based on our experiences.
Mm-hmm.
If someone tells you you're a horrible person, that may stick with you. That doesn't mean it's true, but you believe it's true because you're young and it's molding you. So I think that has a lot to do with our perspective. And I think talking with people, talking that out, is helpful if we have internalized it, to kind of take a step back from it. It's like, yeah, my dad said I'm horrible, but I spoke with my therapist or my friend and they reassured me that that's not who I am as a person. So it may not stick. So,
Okay, so really just sharing,
yeah.
having a conversation, because somebody told me, and you're a therapist, you can tell me it's true or not. Most of our adult life we spend getting over our childhood. I had somebody actually tell me that, and I thought about it. There are a lot of things that do happen in our childhood that it affects us as an adult, and so we need to be mindful of that. To know, I like that example that you use. Like, you may say I'm a horrible person, but I'm not a horrible person. So we don't need to take ownership of what somebody else says about us and begin to write our own story, write our own narrative, and realize that, I am a good person. I do care, and I do care about others and myself. Okay, cool. Um, Postvention, and I say it like this, postvention, because what it is we can do afterwards. When we identify that things are happening, um, what is postvention and how does it protect others in the ripple effect of after a loss? But basically, I guess I'm gonna stab in the dark. Like, whatever happens afterwards,
Yeah.
if let's just say you talk me off of a ledge, and then I'm good. I didn't do it. What should I do after that?
Yeah. So let's say someone dies by suicide.
Okay.
Like a community service board, like Macintosh Trails or whoever is working with the school system, they may like have a debrief. They may have people come in to talk with the people about what happened, so they can process it, have the resources they need. And when it comes to, let's say someone has a non-fatal suicide attempt, making sure they have the resources they need. They may be hospitalized. They have group therapy, individual therapy, and you safety plan with their family. The postvention is that here's our plan, here's what we're going to do if it happens, and here are some resources for you to continue going to counseling if you're hospitalized. And you debrief after if someone does die by suicide and it was deeply impactful to a community. You debrief, you have the people come in, and hopefully they continue to use the resources that are available to them.
Okay. So basically, it's just still leaning on those resources, and I think what I'm hearing you say as well is continue to have that conversation, that we destigmatize, because and I know I'm not trivializing it when I say it, but we can say if my arm breaks, my finger breaks, having any type of issues going on, we go to the doctor. And they prescribe something, they treat it. So basically, the same thing with the brain, same thing with the emotions, is that you're getting treatment for that. So in this time of postvention, that's when we began to, I would think, make a plan from what you're saying. Go get those resources. So we need, as people in the lives of other ones, we need to have information on hand so that people can see. It's not like, oh yeah, go see a therapist, but we need to have a listing. We need to be able to say, you can click this link, you can do this, or you can give them a card. So especially those of us who work in the public sector, we need to make sure that we have knowledge of those resources that are available. Is that what I'm hearing you say?
Yes, ma'am.
Okay. All right. So let me read this last question. I do say read, y'all, because y'all know I want to make sure I'm getting all the information. For someone supporting a loved one after an attempt, what are the first 72 hours and first 30 days supposed to look like?
Yeah. So I think it's creating that supportive environment, making sure they're following through on the plans. Like we said, we would talk to this therapist or talk to several therapists, see who you like, things like that. So just helping with the follow through, being emotionally supportive, and listening to what they have to say and holding them accountable and holding yourself accountable.
See, when you say things just poof in my head. So if there's a therapist or somebody that you're just not jiving with, you don't seem to be getting what you need, it's okay to get another one.
Yeah, of course.
Okay, so we don't just have to stick with the one we were in.
No.
Okay, so people can understand. You can get several if that's what you need, if they're meeting the needs. Well, one of the things that I am so happy, I'm trying to think, treatment that works. I have a topic right here, y'all. Y'all see I'm reading everything, but the only reason I'm reading is because I want to make sure that I am answering the questions, because if it pops in my head, I'm sure it pops in someone else's head. So I want to make sure that all these things that we're talking about, because here in our county, we've had so many things to go on. In our state, there are so many things going on. In our nation, there's so many things going on. So what I want to do is to make sure that we here in Spalding County, Griffin, Georgia, Orchard Hills, Sunnyside, Brooks, that we know that our community is well equipped, but we need to know where to go. We need to have some idea of what treatment works. And so that's why I'm not hard on myself for not reading. So if y'all say she reading out this thing, it's because I want to make sure that the information that you're gathering from this professional is something that I'm pulling from him that will help you. So I'm going to ask this question verbatim. What evidence-based therapies and supports works best? What do you think?
I think that's a difficult question to answer because we're all different.
Okay, I was hoping you would say that.
Yeah. One of the most important things in treatment is your relationship with your therapist, the rapport that you build. So it's important that you do find someone that you connect with. You may not like your therapist as a person, but you're like, when I walk away from my session with this person, I feel challenged, I feel seen, whatever it may be. So you don't always have to necessarily like them, but have some form of connection or seeing some value in it and building that rapport with the person. I think that's the most important thing, because CBT may work for you. That's cognitive behavioral therapy.
Okay, thank you.
Then there's dialectical behavioral therapy. That may work for you. That's more structured. CBT is also structured, but some people pick and choose what interventions they want to use. So several things may work for you. I think you get out what you put in when it comes to therapy. If you go to therapy and you just sit on the couch and you stare at your therapist, you may not get anything out of that.
Except a good nap.
Yeah.
Yeah, okay, go ahead.
If that's what you want to do it. Okay. But if you do the work, because at the end of the day, the clinician can only do so much. He's not the one out there doing the work for you. You have to take the things you speak about and do it. So at the end of the day, it's on you to do the things. So several interventions can be helpful. Okay. You just have to practice what you're learning in therapy.
Okay, and sometimes there's a combination that can be used with us. Okay. Yes, ma'am. All right, how do medication fit into the treatment plan, and what myths would you like to dispel?
Speak about breaking your arm. I think there are a lot of people who break their arm and they don't go to the doctor. There's still this stigma about healthcare, especially with men. It's like, it'll be okay. I'll walk it off. It'll heal. Get help when you need it would be my suggestion. And people are afraid of seeking help because they feel they may be viewed as weak. I'm vulnerable. I'm weak. People are going to think differently of me. That's not always the case. If you need help, seek it out. When it comes to medication, there's this fear that once I start taking it, I'll have to be on it forever. That's not necessarily true. You can titrate off the medication with the help of your doctor. It's like, hey, I think I'm doing better when it comes to handling my anxiety or my depression. I'm working with my therapist, I'm learning coping skills, and I'm having less symptoms, not necessarily due to the medication. So I think I want to step down to see if I can manage this myself.
So it's a partnership between you and your therapist about how the medicine works for you, or sometimes don't work for you. Okay.
Yes, the doctor, you Your therapist is
Hmm.
supposed to be a team. It's your
Okay.
care. Make sure
Okay.
you're getting the care you need.
Okay. Now you said a team, and that's the thing that I think is missing sometimes, that support that we have from people from the outside and not necessarily holding everything in. You talked about isolation, and if you isolate yourself, that just mitigates the connections that you could have.
Mhm.
So one other thing, what does recovery actually look like over months and years?
Yeah. So recovery is not linear. You may take a few steps back in your recovery. When
Mm,
when it comes to therapy, things may come up that you've never spoken about before, that you had this deep shame with. And that can make you regress in some way. But if you continue, if you do the work, if you and your therapist have a good relationship, you will see progress. So recovery looks different for everyone. It's not always going to be pretty.
mhm.
Sometimes it has to be bad so that things can be
Get
clearer.
better. I got you. All right.
Yeah.
Okay. Well, I know one of the things that's happening around our local community, there's a recovery bus coming through. And then we're going to, whenever I say put a pin in it, it's something I want to come back to, is that substance abuse. Um, there, there are a number of our citizens, a number of residents that, may struggle with the disease of addiction. What would you advise them to do if they see that they have this problem?
Yeah. I would suggest they seek out treatment. And that's not necessarily mental health counseling. It could be AA,
Hmm.
it could be Celebrate Recovery, finding a community that supports you and helps you be better without the
Hmm.
substances. Because a
Okay.
lot of it too is that missing piece of connection.
Hmm.
Some people turn to that when their family life isn't good. Nobody hears them or sees them. They use the substances to cope. They form a community with the other people who are using. And that kind of continues that.
Hmm.
So, kind of finding other people who can give you the support you need, who see you, so
Okay.
you don't need to rely on substances to cope. And to,
Okay.
so,
John
I know, and
Tavius, I really appreciate you sharing so much information and you bringing it from an expert's opinion who lives right here in Spalding County. So you're serving people who are in need of help that we may or may not know. I think that's important because you can see some of the things that are happening and how it's affecting people in our county. But I kind of wanted to bring us, just let you know, things are just not happening in Spalding County throughout the state of Georgia. I'm just going to read some data to you of things that are happening in the state of Georgia so that we can see and then narrow it down to Spalding County. But according to the statewide context and reporting system, Georgia Violent Deaths Reporting System, that's what it's called. One of the things, the Georgia Violent, they track county level data on suicides, homicides, unintentional firearm deaths, and deaths from legal intervention. The data is compiled from death certificates, law enforcement, medical examiners, and EMS reports. So I'm just going to start with gun deaths in Georgia, and this was like 2023 data, but it'll show you the alarming things that are happening in the state of Georgia. Total gun deaths were 2,070, and on those gun deaths, suicide was 1,116, homicides was 892, and these are all suicide deaths, gun deaths with suicide and homicides. Okay. Firearms were used in over 50% of suicides and 70% of domestic violence related homicides. Young black males ages 15 to 34 accounted for 45% of gun homicide deaths, despite being only 5% of the population. That's telling you that suicide trends in Georgia, suicide rates have increased 36% between 2000 and 2022. Now, we haven't gotten to the data yet for the 23, 24, 25. This just back in 2022. The Georgia Suicide Prevention System provides, regional data. So once we get that data again, I will make sure that I bring it to you. I will inform you of it. But pretty much, y'all, we have a problem. And I love the fact that we're bringing awareness to it because the thing about it, if you don't identify a thing, you can't do anything about it. So that's where the I in Spalding, We're saying we're focusing in, we're being laser focused on the things that are happening in our community. And this is one thing that I know that we need to pay attention to. So again, and I'm not going to end on a bad note, because how can you dress that up? You really can't. But what I can say, there are resources available. And what I'm going to do is just list a couple of them that I do know. Of course, SEED. SEED, tell me what that stands for again.
It's just a different way to spell seed.
Just a different way to spell seed. Okay.
Succeed, exceed.
Oh, so succeed, exceed. I like that. Community enrichment. But we have Pine Woods Behavioral Health Crisis Center. We have Pathways Center in Spalding, Behavioral Health Centers, and Spalding County Resource Directory. It has everything. And so, one of the things I want to leave you with, one of the things is that we are we are keeping an eye on things in Spalding. That's what I like to call it. Is that keeping an eye on Spalding and understand that the mind matters. The mind matters because it dictates how we move. See, if we're thinking a way, then we're moving a certain way. If we're pointing the needle in the direction that, hey, we need to we need to help with it. The tip of the spear needs to be us saying that we are going to address the needs in our community. But one of the things I wanted to, a couple of tips for promoting positive mental health in our community is, and really, it just sums up what you told me. That's to foster social connections. We got to begin to spend time with each other, y'all. Create a safe, supportive space. You talked about that safe space in which people can feel they can talk to us about things. And normalize mental health conversations. It's not anything to be ashamed of. It's not anything that has to have a negative stigma. It means that we are helping those citizens who may be in need of this type of resource. Integrate mental health education. Let folk know that it's okay. And let them identify if there are some emotional issues, some mental issues, substance abuse issues. We need to be able to say, yeah, I understand that this is the help we need for you to have. So integrate that mental health education. Encourage schools and workplace to include mental health literacy, coping strategies, and access to counseling. And I think that is so key. And the last, but certainly not least, empower community voices. We all got to begin to cry loud. We all got to begin to say, y'all, this is okay. We understand it's a little overwhelming. We understand that, you can't do this alone, but we're the people. We are the I in Spalding. We want to help, but we're also the I in Spalding, keeping an eye on you because we understand that the mind matters. So live one daily habit that protects mental health. That's how you live. One daily habit that protects mental health in Spalding County. Work. A manager's best sentence for a struggling employee. That I appreciate what you're doing today. Thank you for showing up. And then to play a low cost activity that's this realistically that can lift the mood. Sometimes there are swings downtown Griffin. Go swing. There's a community garden. Go play in it. There's a senior center. Go get involved in activities. For our young people, their leisure services have so many things going on with sports, with cheerleading, with dance, 4 H club. They have a number of things. So, y'all, remember, we're not just the I in Spalding, but we're keeping an eye on you every day. So, John Tavius, thank you so much for being my guest. And again, we are the I in Spalding. Live, work, play. Have a good day.